Good evening, everyone. Welcome. Thank you for being here. It's a Thursday night. It's probably one of the last nice nights we're going to get in a while, so I'm particularly grateful that people are willing to spend a little time indoors. I will acknowledge that it's in return for university appetizers and wine, which are always a bad idea, but hopefully it's been a good time so far. So I'm Stanley Brown. I'm the Dean of the Dalai Lama School of Public Health here at University of Toronto, and along with our partners and our sponsors, we're the host tonight. And I'm just really grateful that everyone has been able to come. I'll start tonight, though, with the land acknowledgement. So we wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, Seneca, the Mississaugas of the Credit, and the Haudenosaunee. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Now, the first order of business tonight is a welcoming prayer from an elder. And so I'd like to invite Mrs. Betty Kajichase Miracle. She comes from the Tainadega territory, and if you kind of read about her online, you'll see that she doesn't introduce herself as an elder. She likes to be referred to as a grandmother. But that sort of humility, I think, finds its kindest reflection in how others call her Ista, which is the Mohawk for mother. Ms. Miracle, would you come up, please?
Sego Oguego Gajujuse Young Yats, E. Oguari, and I'm from Tyendinaga, the land of the peacemaker. So my name, Gajujuse, means a flower and what's the flowers doing, and it's a Bear Clan name. And so I want to say how honored I am to be here, to work for creation. And our Creator is the greatest honor anyone could have. And so I'm truly grateful to be able to stand here and share with you our Ohundagar Dakwa, the words before all else. And so I'll do it in our language, and then I'll translate a little bit in English, because this prayer can go on for 2 hours. I have sat in ceremony and heard, our leaders do this prayer, and they acknowledge everything. And so at this time, I will do the Ohundagar Dakwa. And what it is to bring all our minds to a good place of giving thanks and gratitude for life. For all life. So, Deyati nu arado ne ungwin su'a, oni du haknakwat nikula. Deyati nu arado ne yati nini stahan jio hinjade, oni du haknakwat nikula. Deyati nu arado ne gahni garunyo, danon ganjon su'a, oni du haknakwat nikula. Deyati nu arado ne jon hakwa. Oni du hakna kwat nigula. Deyati nu arado ne gandirio. Oni du hakna kwat nigula. Deyati nu arado ne garundo suandara ogade su'a. Oni du hakna kwat nigula. Deyati nu arado ne yeti sutas and tanaka garakwa. Oni du hakna kwat nigula. Deyati nu arado ne Deyati nu arado ne yeti sutta asantanaka garakwa, oni du hakna kwat nigula. Deyati nu arado ne gandirio, oni du hakna kwat nigula. Deyati nu arado ne radiveris, oni du hakna kwat nigula. Deyati nu arado ne yojisto garunyo jiskanyagi. Oni du hakna kwat nigula. De chite wadarado ne sungwat jia jokanaka garakwa. Oni du hakna kwat nigula. De ati du arado ne gaere nigarage. oni duhak nukwat nigula. De ati nuara done ingwedige, oni duhak nukwat nigula. De chite watera done. And so then after I give thanks to the waters, because the water is the blood that flows within our Mother Earth, and she flows within us as well. So without it, we couldn't exist. Nothing would. And so we acknowledge the waters and all the gifts that they give us. And also I acknowledge the fish in the water, which is the ones that attack the radicals or the things that happen to us in our bodies. It's the fish that's taking care of it. And so to them, I acknowledge them. And then I acknowledge the four-leggeds. And the deer is the leader. In every one of them, there's a leader. And so the deer is the leader for us because of what it provides for us and what it told when it was created and put on Mother Earth. The deer said they would take care of us with the humans. And they have. They feed us, they clothe us, they give us shelter and many other things that we may not know about. And so to them, we give thanks. And then I thank the foods. And when I thank the foods, I'm thanking the three sisters, the corns, beans, and squash. And there will come a time when those three will be the ones that will preserve for us, for our lives, because they provide everything for us, the nourishments that we need. And so if you have those, then you will survive. So to them I give thanks. And then I thank the trees, the little trees and the big trees, and especially the leader, the maple tree, is the one that provides medicines, special kinds of medicine for us, and shelter, and our fires, and many other things, too, that we don't know about or we have forgotten. And so I give thanks to them. I give thanks to the birds for their songs and everything that they give us. Because as birds, you hear them first thing in the morning. They're telling us, they're reminding us to give thanks and to be grateful. As human beings, that's the only thing that we were asked to do, is give thanks and love one another. So they remind us. And then again at night, before they go to sleep, they do the same thing. They remind us to give thanks and be grateful for the day. So then, after I give thanks, basically for the medicines here that help us, everything on Mother Earth I give thanks for. And then I go into the universe, and the first one is the ancestors. I thank them because we are all the DNA of our ancestors, and we must not forget them. They're always with us. They're always there to help us and guide us and protect us, and we're not to ever forget them. So I give thanks to them. And then I give thanks to Grandmother Moon for continuing to bring forth the new life and all that she does and the relationship she has with Mother Earth, her daughter. And also I give thanks to the sun, our eldest brother, the sun. She has a relationship with him too. And what he gives us, light, warmth, he takes care of us. And we need to give thanks, and I do. And then it's the thunders for coming and bringing that fresh water and blessing us. We should always be grateful when you hear them. Give thanks to them. Acknowledge them for bringing that fresh water. And then I give thanks to everything in the universe. And then I say to those four sacred beings that sit in every direction, in the four directions, for continuing to keep the cycle going and protecting us and helping us. So I give thanks to them in acknowledgement. And then the last is Sungwayat Diso, the Creator, He who completed us human bodies in all creation. And I give thanks to Him, or whatever, we don't know for sure, him, her, whatever, but we do know without a doubt there is a higher power than ourselves, and everything is put here for our enjoyment in life, and we're not never to forget that. We have to come back to that center and start looking at each other with love and compassion. And that's why you are here, you know, to honor those that have given so much for the well-being of human life, and hopefully for the natural life as well. And so that, I will say again, how honored I am to be here. So Nyawako, and I want to acknowledge my, the chief, my cousin, for all the hard work he does. People have no idea the sacrifices and the love that he has for our people. And so I want to say, Nyawagoa, for your love and compassion for the people. So at that, I say, Nyawa to everyone.
Thank you, Kajija Say. Thank you, Betty Miracle. And thanks to Lynn, and thanks to Chief Miracle for bringing her to us. I appreciate it very deeply. So tonight, we're here to honor the finalists for what is hopefully the first annual Ontario Health System Quality and Innovation Awards. And I think it's nice to pause and realize that our health system should be a reflection of our best selves. The care we give to people when they're most vulnerable, when they're most ill at ease, reflects at a personal and at a principled level what we want to be as a society. When we make the steadfast and persistent commitment to improve this care as the nominees here have done, we give proof to these better selves, and we protect the trust that people put onto us. So whether it be in the clinic or in the community, in the hospital or in the shelter, in person or online, my thanks go first off to everyone who's a nominee here tonight and for all the people who submitted nominations. And there's actually much proof of our better selves. When we started off thinking about this, we said, how many nominations do you think we'll get? We thought we'd get maybe 100, and we doubled that. We thought, okay, do you think we'll get a sponsor or two? And we thought maybe we'll get a couple, and we far exceeded that and been very lucky with the gifts that they've given to help us here. And when we started, we thought we might fill the room, and we've gotten in trouble tonight because there's not extra tickets available. I will say, for those of you who are careful like I am to do the counting, there are a few seats empty at the front. That is true at every U of T class and event. So tonight's a sold-out event, and I wish we could accommodate everyone who wanted to come. I guess our first note for the next time is that we try to get more space and we try to get a bigger venue. But this shows our appetite for celebrating the amazing achievements of our nominees, and it gives us a goal for next year. So let me move on to some thank yous. So first, like I said, my first thank you goes to the finalists. It's a challenging time in our system, but these are the examples that we need and the examples that will support us. I want to give thanks to our partners, the Ontario Hospital Association, the Ontario Medical Association, and Ontario Health. Without your support and encouragement and nudging and advice, we wouldn't be here tonight, so thank you. And I want to give thanks to our sponsors, the Ontario Hospital Association, Merck, Ellis Dawn. We actually even have the project manager for this building here with us tonight, so I think that's a good recognition. Shoppers Drug Mart and the Clerici family. And I want to make a special thanks to Darlene McLeod, Elon Altar, and Kira Kilbride Amaral, who this would not have been possible without. I have to do all this because I don't want to give the impression that universities can actually do anything, so we want to thank as many people as we can. And let me also say thanks to the strategic group who has helped shape tonight. Anna Greenberg, Sabina Vore-Miller, Helen Angus, Dr. Kwame McKenzie, Dr. Chris Musquash, Chief Don Miracle, who you've already heard of tonight, Connie Clarici, Dr. Andrew Bruzzari, Gary Froud, and Paul Dell'Alana. Now, I'm going to get off the stage and introduce someone who's going to steer us through tonight. And so it's my pleasure to introduce Kelly Lee Evans. So tonight, we're celebrating the talented teams and individuals who have persevered through challenging times to make an impact on our health system. And our MC tonight is no stranger to perseverance and has an immense talent herself. We're fortunate to have Kelly Lee Evans, an internationally acclaimed Juno Award-winning singer and songwriter, join us. She has multiple albums to her name, and really, even after a grueling touring schedule, she experienced life-altering events in 2013 and 2015 that dramatically affected her health. For the next 2 years, in addition to all this, she's a mother of 3, dedicated herself to recovery so that she could get back to making and sharing music and joining us at things like tonight, a joyous occasion. So, in the summer of 2017, she returned to the stage, and in 2018, her album Come On was nominated at the Juno Awards for Vocal Jazz Album of the Year. We're so pleased to have her here with us this evening. You'll realize that if you've ever seen me on TV, it's a bad thing. If you've ever seen her on TV, it's a wonderful thing. So, please help me welcome Kelly Lee Evans.
September became anew, locked in a battle with a chosen few. Argue some ridiculous philosophy, separate the me from me. June brings sweet escape. I'm free like Virginia, mind jumped the state. Another realm of servitude, clothed, but my mind is nude. High mountains over endless seas, you'll never reach me. Skyscrapers may trap my mind, but I know that I'm built to fly. I'm built to fly. Oh, yeah. Now a citizen of the state, never really ever graduate, shackled to the road that leads underground, chained to the wheel I run around and around. But I'm like dynamite, blast through with a glimpse of light. I rise like Superman, I know what I am. High mountains over endless seas, you'll never reach me. Skyscrapers may trap my mind, but I know that I'm built to fly. I'm built to fly. Oh yeah. Irreverent Iron Man, dream full color, just like Stan, a warrior woman, a wonder I am. Captain, crew, journeyman, sleek like the cat I own the night, sly like the bat, hide from sight, nimble like the spider I climb. I soar, I remember what I'm fighting for. High mountains over endless seas, you'll never reach me. Skyscrapers may try my mind, but I know that I'm built to fly. Thank you very much. My name is Kelly Lee Evans, and I was built to fly. Well, that was like the goal of my mom, who immigrated here in the 1960s from Jamaica via England. Now, as a black female at that time, she was told she could be one of three things. This is what she used to tell me. She could be a bus driver, a postmistress, or a nurse. And so that's what she did. And she came here to Canada, and when I grew up, she told me that I could be anything I wanted to be, as long as it was a lawyer, doctor, or engineer. So I was that 3-year-old kid who would tell everybody I was going to be an OBGYN when I grew up. And I used to go to where she was working at Scarborough Gen. She was at Toronto East General. She went to Centenary, and she worked at Scarborough Gen. And I used to watch her and just be so inspired and hear her going up and down the halls talking to all of the patients. And as soon as I could, I became a candy striper. And really, I just didn't really have the marks for it. Sorry, everybody. And so today I'm a singer, but I'm still incredibly inspired by the work of our healthcare community. And I am so happy to be here as a part of the Ontario Health System's first Quality and Innovation Awards. This is so, are you guys excited? I don't see excitement. That is the kind of excitement we need, everyone. All right. So before we introduce the finalists for our first award category, we would like to acknowledge 3 individuals who were recognized this year by the Dalla Lana School of Public Health for their outstanding Black leadership in public health and health systems. In addition to going above and beyond in their roles, this year's recipients have also demonstrated meaningful support of those around them, including future generations of health leaders. This year's recipients were Delilah Ofosu-Barko, Corey Bernard, and Angela Carter, one of whom, yes? So one of those recipients is here with us tonight. I'm not sure who. Do we know? Is it Corey? Aw. Yes. So thank you so much, Corey, and please join me in congratulating all of this year's Black Leaders in Health recipients. So now for our first award presentation. The Increased Equity Award nominees reduced inequities and met the needs of equity-deserving populations to improve health outcomes. They fostered organizational cultures focused on equity, inclusion, diversity, and anti-racism to support better health outcomes for everyone. Anna Greenberg, Chief Operating Officer from Ontario Health, is joining me on stage to present the award. Anna?
Kelly Lee, thank you for making us all feel something. I think very fitting for the celebration we have tonight and the work of everyone being honored. Good evening, everyone. On behalf of Ontario Health and my colleagues who are here tonight, we are a proud partner of the inaugural Ontario Health System Quality and Innovation Awards. And let me just acknowledge Stani for your leadership and inspiration for this. Thank you. It's a pleasure to be part of the rare moments that we come together to formally recognize and celebrate excellence and achievement in healthcare delivery in Ontario. It's my honor to present the first award focused on increased equity. We have no shortage in our health system of seemingly intractable problems that we need to solve if we want all people in Ontario to have the opportunity for the best possible health outcomes. More than ever, we need diversity in our perspectives, our expertise, insights, lived experience, voices, and ways of working so that we have the best chance of achieving equity in health. The top 3 finalists for for the Increased Equity Award all reflect this ethos. They are Breaking the Cycle of Violence, BRAVE, Ontario Health, Toronto Region. Mobile Medical Support, bringing quality health care to your front door, Ontario Health, West Region. Pursuing Equity Team, addressing barriers and enhancing cultural safety, Ontario Health, Central Region. And the winner is Mobile Medical Support, bringing quality healthcare to your front door. Erie Shores Healthcare's Mobile Medical Support launched during the COVID-19 pandemic to bring healthcare directly to vulnerable communities. In partnership with the Windsor-Essex Ontario Health Team, Mobile Medical Support offers healthcare services while reducing costs through prevention, early diagnosis, and decreasing emergency department visits. Congratulations.
I have to admit, my last name starts with a W, and so I'm always the last person to come up on stage, and I always enjoy watching other people be the first one, so this is a first for me tonight. But good evening, everyone. I'm Amanda Wilms. I'm the Director of Community Outreach at Erie Shores Healthcare, and I have had the privilege of being involved with Mobile Medical Support since the very beginning, since it was just an idea on paper. And I'm truly honored to accept the Increased Equity Award on behalf of our staff and all of our partners. This program is a shining example of our commitment to making sure everyone in Windsor and Essex County, especially those who face the greatest challenges, have access to quality health care. We launched the Mobile Medical Support Unit with one goal: to address the healthcare gaps in our region. We recognize that many residents struggle with transportation, mobility, and financial barriers. So instead of waiting for them to come to us, we brought essential healthcare services directly to them right in their communities. Our partnerships with the Windsor-Essex Ontario Health Team, Canadian Mental Health Association, Windsor-Essex Community Health Centre, and over 45 other community organizations have been vital in making this happen. They've provided invaluable insight and support, allowing us to reach some of the most vulnerable people in our area and making sure they receive the care that they need. Since April 2022, the Mobile Medical Support Unit has had a tremendous impact. We have had over 4,000 visits delivering crucial services like routine checkups, preventative screenings, urgent care, and mental health support. We've helped catch early signs of diabetes, hypertension, and various cancers, improving health outcomes across the board. Not only have we eased the strain on our emergency department, but we've also helped foster a culture of preventative care in the community. Seeing the real difference that accessible healthcare can make has been incredibly rewarding for all of us. This achievement wouldn't have been possible without the dedication of our entire team. From our medical professionals to our support staff to our community partners and volunteers, everyone has played a vital role in bringing this vision to life. Together, we're working towards a healthier, more equitable future for Windsor and Essex County. Thank you.
Congratulations once again. The Improved Indigenous Health Award recognizes excellence in providing care to First Nations, Inuit, Métis, and urban Indigenous people, families, and communities within Ontario. Chief Don Miracle of the Tyendinaga Mohawk Council will join me to present this award.
It's an honor to be here tonight. Bring greetings to all from the Mohawks to Bay of Quinte. And Kaylee, that was a beautiful song you sang.
Thank you.
And so we're well represented today with doctors, lawyers, and one Indian chief. The finalists for this award have traveled throughout Ontario, Thunder Bay to Moosonee, representing the medicine wheel of life, north, south, east, and west. They represent Indigenous people, families, communities from across Ontario. Let's applaud their incredible achievements. The top 3 finalists for Improved Indigenous Health Awards are Bringing Specialist Care Close to Home, Ontario Health Northeast Region, Community-Based Diabetic Retinopathy, Screening Utilizing AI Technology, a province-wide initiative, Misqua Bidabin Team and Indigenous Health Supports at Thunder Bay Regional Health Science Centre, Ontario Northwest Region. And the winner is Bringing Specialists Care Close to Home, Equitable Cardiovascular Care in the James and Hudson Bay region of Ontario. The Winnebago Area Health Authority, WAHA, and University Health Network, UHN, collaborate to bring specialist cardiovascular care closer to home for Indigenous communities of the James and Hudson's Bay region of northeastern Ontario, which started as soon as the post-COVID lockdowns were lifted. The WAHA UHN cardiovascular program successfully provides culturally safe and relevant care for Indigenous patients by building the healthcare team locally, integrating digital technology into patient care, engaging the community, and responding to demand for in-person clinics as well as virtual care, sustaining and evolving care partnerships. This innovative program inspired an animated film that was premiered at the Toronto Shorts Film Festival.
Wow.
Just one more, in our culture, the eagle represents the bird that flies the closest to the Creator. It has the most strength, it watches over creation and warns of approaching danger. So when you're given an eagle feather, this is the highest honor that our nations can give. So I present this eagle feather.
What an honor. Truly touched by that. I think we all know that we are coming up to Truth and Reconciliation, and we all recognize that it is incumbent upon us to ensure that everyone living in Ontario has equitable access to high-quality care, which is really the start of this desire to bring care to where patients are at, to bring care to people in their homes, leveraging technologies, Health Canada approved technologies to improve care. And it's been, this is an incredible honor to receive the award, but in many ways, I have grown so much through this journey, and I have our colleagues to thank for that. Thank you very much on behalf of our team, and I would ask Kristen to say something.
I just wanted to say thank you on behalf of Winnebago Area Health Authority for this award. and also from the James Bay community members of Pewanik, Saskatchewan, Attawapiskat, Fort Albany, and Moosonee Moose Factory. We also thank you so much for this award. This program is amazing, and we continue to be hopeful, thankful, and grateful for the best cardiac care. Miigwech.
Miigwech, and congratulations. The Improved Patient Experience category had the majority of nominee submissions, and the competition was rigorous. Those nominees represent a broad spectrum of excellence in patient care that ensured patients received the right care, in the right place, at the right time, and importantly, in a manner that was organized around the patient. Please join me in applauding all the nominees. Christine Elliott, Health Law Counsel at Fasken, Martineau, and Dumoulin, former Minister of Health and Deputy Premier, First Ontario Patient Ombudsman, is going to join me in presenting the Improved Patient Experience Award. Christine?
Thank you very much, Kelly Lee, and good evening, everyone. It really is a true pleasure to join you tonight to present this award. The top 3 finalists for the Improved Patient Experience Award are Caring for the Caregiver, Sick Kids and Women's College Hospital, Ontario Health, Toronto Region, Connected Care at Sick Kids, Ontario Health, Toronto Region, and Integrated Care Program at UHN, Ontario Health, Toronto Region. And the winner is Connected Care at Sick Kids.
My role as a nurse at Connected Care is pretty awesome. So what we do is we try to get teachings for family caregivers, bringing out their confidence for them to go home, taking care of these medical technologies for their child. So right here is that guide wire. Okay. The purpose of that guide wire is to guide the wire in. Okay. Exactly. When a family comes to us, usually they're quite nervous, which is totally normal for a kid going home, for example, with an NG tube. We also try to support home care nurses in the community, taking care of other people's kiddos with those medical technologies and strengthening their knowledge and understanding and just having that confidence to take care of them and take care of that medical technology. What makes the kids a really great place to work is honestly, it's honestly the people that you work with. Nursing doesn't stop. We're literally here days, nights, weekends, holidays. So if you have those days that are really hard, you can always rely on your sick kid's family to understand we're all so close together.
Connected Care improves access to high-quality pediatric care by providing 24/7 real-time virtual clinician support to families and their home care providers. The program also delivers in-person and virtual education to families as well as home care and community hospital providers to promote self-efficacy, enable informed decision-making at the point of care, and build system pediatric clinical capacity. Congratulations to the entire team at Sick Kids.
Well, thank you to everyone. What a thrill. I've never been to the Academy Awards, but I'm
I'm really delighted to be here, and I know that the team from Connected Care at Sick Kids joins me in being just so very grateful for the nomination. I want to really also start by congratulating the other nominees in our category, the finalists tonight. You are innovative, you are leading, and you are also inspirational, and we have connected many times in the past few years, so we appreciate your partnership. In accepting this award, Connected Care takes pride, and we first share the recognition with family caregivers of children with medical complexity and our Connected Care family advisors. They spoke up and made Connected Care happen and continue to guide us and share us with their invaluable expertise. Acknowledgement also goes to our partners in home and community, numbering over 50 agencies that we collaborate with who take our classes, text, talk, and video our team 24/7, and show up every day to care for patients and families who we discharge from Sick Kids with new medical technologies to be cared for at home. Finally, I collaborate to lead Connected Care at Sick Kids with some of the most outstanding minds and hearts that one could ever work with. So thank you to all of us on the team. And tonight, special thanks to Judy Van Cleef, to Kate Langridge, to Paul Davis, to Julia Orkin, to Stephanie Chu. And I did notice Dr. Ronnie Cohen kind of sneak in there, and appreciate that the opportunity to work with this team has been the work of a lifetime. On a personal note, I'm privileged in my role at Sick Kids. I lead and I live out really my hopes and dreams as an early family caregiver, a young family caregiver in my background before nursing. And I live this out to support more seamless transitions for Sick Kids patients and families, and have the opportunity to work with this team and so many others across the health system. For that, I am so grateful, and I thank you, HPME, the University of Toronto, Ontario Health. This is a beautiful evening, and the recognition is so much appreciated. We are thrilled, and we have our bag to carry that home. Thank you so much.
Congratulations once again. Avis Vivaro, Santis Health and noted health journalist, is going to join me now on stage to present this next award. The Excellence in Health Communications Award recognizes communications teams and individuals who have successfully worked in collaboration and partnership with other organizations, patients, communities, and healthcare service providers on a project or campaign using accessible formats or appropriate platforms for the target audiences.
Thank you very much. And I must say, I'm so happy to see health workers getting awards.
Yeah.
I've never seen that. Whoever. I mean, it's much better than banging pots. And this award is about communication because words matter. That is the beginning of healing, of healthcare. It's communicating. And that's what this is about. So the top 3 finalists in this category are Ask Me GOC, a novel e-tool to facilitate the goals of care discussions, Ontario Health Central Region; Chinese Digital Health Literacy Program, the Ontario Health Toronto Region; and the Dementia Strategic Fund, APNA Mind, APNA Body, Toronto Health Central Region. And the winner is, I do not have an envelope. Oh, you're going to give me an envelope?
We are offering free dementia activity kits to Ontario residents
There's the
These
winner.
kits are a great way to promote and
The
stimulate
Dementia Strategic
engagement
Fund.
and enjoyment for persons living with dementia. These mind-stimulating activities can help individuals express themselves through creativity, socialization, brain stimulation, and help exercise their cognitive abilities. Each kit will include the following: jigsaw puzzle, fidget cube, coloring book, markers, aqua paint, easy brain exercise book, limited quantity for Joy for All cat or dog. For more information on the products and to place an order, visit us on our website www.apnahealth.org.
Thank you so much. I thought I was going to have to come up here by myself, but then I saw everybody else brought people along, so that made me feel a little bit better. Thank you and good evening. My name is Navneet Dhillon, and I'm the Director of Health Services at Indus Community Services. On behalf of Indus, I would like to express our heartfelt gratitude to the Ontario Health System Innovation Awards Committee for this honor. Our dementia project, which focused on raising awareness in the South Asian community, has impacted thousands of lives through language-specific education sessions, resources, and through partnering with various organizations to promote dementia-inclusive communities. Dementia often carries a stigma in the South Asian community, and it has been rewarding to witness the profound effects of this important projects in the lives of the vulnerable communities we serve. We have received countless messages of feedback from caregivers across the province who have shared how nice it's been to be able to get a resource that they can read in their language, such as Hindi or Punjabi or Urdu, so that they're able to connect on another level with their loved one. So we're really thankful for this award. In closing, I want to thank the incredible team that's on the stage for their leadership and unwavering support. Thank you so much. And we are excited to continue to push this work forward.
The importance of the Improved Care Team Wellbeing Award cannot be minimized. Maintaining a healthy care team addresses staff burnout and improves morale with innovative processes. Ontario Healthcare Services are at risk because of significant staff shortages. This award recognizes increasing care team well-being and implementing innovative processes to address burnout and improve morale for frontline and other healthcare staff. I think it meant to say heroes. Matthew Anderson, President and CEO of Ontario Health, knows that our healthcare system depends on the well-being of the people who show up every day to deliver excellence. Matthew?
Thank you, Kellyanne. Thank you, Staney. Thank you to U of T and to all the sponsors. This is fantastic. And it's been a very, very long time since I've been in front of like real people. It's really quite amazing, although you're sort of in darkness a little bit, and it sort of reminds me of most of my meetings where you turn the camera off, right? I am really thrilled to be here to present the Improved Care Team Wellbeing Award. As Kelly Lee, commented on, this is a really important award. In our healthcare system, it's really essential that we take care of our healthcare providers who are so dedicated to taking care of everybody else. Sometimes while we're taking care of everybody else, we forget to take care of ourselves. Improving provider experience is a critical component of the quintuple aim. And before I give out the award, I thought for a moment perhaps you would join me in applauding all the care teams throughout Ontario who've contributed their excellence to all the citizens of Ontario over the last few years. The top 3 finalists for the Improved Care Team Wellbeing Award are Bridging the Gap, Enhancing Staff Engagement and Retention at Runnymede Healthcare Centre, Ontario Health Toronto Region, Hamilton Health Sciences Shine Wellness Program, Ontario Health West Region, and Revive and Thrive, a commitment to workplace wellness, Ontario Health West Region. And the winner is Hamilton Health Sciences Shine Wellness Program.
Self-care is a pillar of overall health with tremendous benefits for ourselves, our team, and our community. You are the HHS community, and the Shine Wellness Program is here to help you. Our mission is to educate and maintain a healthy workplace culture that helps employees achieve optimal well-being, enrich quality of life, and enhance patient care. We help employees build skills to prevent health issues through activities like our Stretch Break program, Employee Family Assistance Program, fitness classes, massage clinics, and pet therapy. We run wellness challenges, lunchtime sessions, snack and learns, and have a smoking cessation program. Together with HHS staff input, we're removing barriers by developing policies, practices, and advancing environmental changes that support self-care. To see what programs will improve your self-care, visit a Shine Wellness Center on site or our page on the Hub.
Well, I can honestly say I didn't know that's the video we were going to be playing. Glad you got to see me in my workout gear. We are so honored to accept the Ontario Health System Quality Innovation Award for Team Wellbeing for the Shine Wellness Program at Hamilton Health Sciences. We would first like to thank our fearless leader, Susan Cucciarelli, for mentoring us and giving us the autonomy to develop and grow the Shine Wellness Program to what it is today. Like many hospital workplace wellbeing programs, we had to rebuild it after COVID hit, and it really wasn't easy. During these challenging times, our mission statement of promoting healthy workplace culture to help employees achieve optimal well-being, enhance their quality of life, and better serve patients got us through to mold our program to what it is today. We would also like to thank our Shine Wellness champions, who are dedicated advocates for the wellness programming across our hospital locations. And we would not be where we were today without the support from our partnerships with the HHS Volunteer Resources, YMCA of Hamilton, Burlington, Brantford, and Niagara, City of Hamilton Public Health, Ron Joyce Children's Mental Health Program, and the Ontario Caregiver Organization. Lastly, we would like to thank all of the passionate, hardworking placement students and wellness volunteers who have developed and implemented wellness programming across our hospital sites. We could not have done this without all of you. Thank you.
Ontario is currently facing rapidly growing healthcare challenges. Given these challenges, the Improved Population Health Award recognizes projects that improve health outcomes for an entire population or group. Michelle D'Emmanuel, Secretary of Cabinet, Head of the Public Service, and Clerk to the Executive Council of the Government of Ontario, will join me as we applaud all of the amazing nominees in this category. Michelle?
Thank you so much. First off, I just have to correct the record. There was an egregious error made at the very beginning. Staney, where are you? I can't see your, there you are. When you stand up and you are on TV, there are two words that all of us think about: trust and gratitude. Thank you for your leadership in this system. It is such an honor to be with so many of you, so many former colleagues that I had, and to be here to recognize the outstanding work. And for all those of you who have been nominated, and for those of you who have been fortunate to win tonight, I know we all know each and every day throughout this system there are heroes at every level, in every organization, in the community, and in hospitals who are making this province healthier each day. As many of you know, I spent more than a decade in the system running Canada's largest community academic hospital. But I actually got my start in social services and learned very quickly, that the determinants of health are what really create a healthy population, and the focus on that. I cannot be more proud to be presenting this particular award. The 3 outstanding finalists of this award have each created innovative programs that have improved healthcare and the health of our community. And when we talk about our community, we're talking about people. This leads to a better experience for that community, and a better experience for a community here is a better Ontario. So let's first off applaud all of the nominees who have made this commitment to others. The Improved Population Health Award finalists are Heart Harmony, who developed a model of integrated care that improved access to heart failure services for patients in the Huron-Perth community. Hyper-Local Community Health and Information Fairs, which provides low-barrier access to care like cancer screening and blood pressure checks to equity-deserving populations in the North York community. And SOS, Supportive Outreach Services, who provide person-centered, wraparound mobile care in Grey County that reduces barriers to health and social services for those who need it most. And the winner is, I actually know, SOS, Supportive Outreach Services.
As some folks might know, the opiate crisis really hit a peak during the COVID outbreak. In some communities, overdose deaths went up to 60%. The SOS team is a multidisciplinary, multi-agency team aimed to provide health, social, and wraparound services to folks in our community who might not otherwise have access or the ability to reach our traditional services. One of the things that makes our program really unique and points to the success is how we've been able to collaborate with so many agencies in our communities and build on their successes and resources. In the first 6 months of the initial pilot project of SOS, there was over 300 primary care visits, over 300 mental health harm reduction visits, over 1,200 unique clients, and over 3,000 units of basic care needs delivered to patients. We travel where we're needed, all over Grey Bruce. We bring with us whom is most appropriate, the best resources available. Very frequently, we're meeting folks in the streets, in their apartments, sometimes at other agencies, just trying to make folks feel comfortable in whatever environment works for them. Good evening, I'm Heather Prescott. I'm the nurse practitioner and clinical lead for SOS, and I'm glad I'm not the only one embarrassed to see ourselves on video tonight. It's with immense gratitude that I stand here to accept this award on behalf of our team. This recognition is not just a testament to our hard work, but also the collective spirit of compassion and resilience that drives our mission. Our mobile model of care has revolutionized the way we serve our marginalized, our vulnerable, and often overlooked unsheltered populations that battle severe mental illness and substance use disorders in our rural context of the County of Grey. It's not merely a service that we offer, it's a holistic approach that embodies harm reduction philosophies, prioritize dignity, respect, and empowerment. We've transformed traditional healthcare barriers into bridges of support. We meet individuals where they're at, both literally and figuratively. Our team of women has shown that with creativity, with grit, and commitment to holistic care, we can change lives. Together, we've built a community where hope thrives, opiate-related harms and deaths are reduced, and recovery is possible. Thank you to everyone who has believed in this vision and has worked tirelessly to bring this to life. This award belongs to all of you. We dedicate it to the harm reduction teams across Ontario saving lives just like us, as well as our partners at the County of Grey, OH West, Bright Shores Health System, CMHA, United Way, and our public health unit, and so many others. Most importantly, this award goes to our beautiful and resilient individuals that we serve. Let this be a reminder that when we innovate with compassion, we can create a healthier future for all. Thank you so much.
one more award up there. And our last, but certainly not least award this evening is the Improved Value and Sustainability Award. Paul Dalalana, Canadian entrepreneur and philanthropist, please join me in presenting this next award. Future healthcare budget projections have identified risks due to various factors. This award recognizes initiatives that increase health system stability, promote efficient recovery, and provide added value to the sector.
Thank you, Kelly and Staney, and to all of our awards and award winners and finalists tonight. It's super inspiring to see all of the great innovation and ideas being generated in the Ontario health system. But with the challenges facing the healthcare system and the need to increase efficient recovery from the pandemic, the nominees for the Improved Value and Sustainability Award are addressing the difficult pain points, closing the gaps, and innovating to ensure Ontario's public health care services are sustained for future generations. The top 3 award finalists are the Humber River Hospital's Hyper-Throughput Operating Model, Protect Connected Health Program at Hamilton Health Sciences, and the Toronto Regional Arthroplasty Collaborative. And the winner is, hang on, I do have an envelope, but I know the answer. Toronto Regional Arthroplasty Collaborative. Thank you. The Toronto Regional Arthroplasty Collaborative, a cross-hospital partnership to reduce backlogs in hip and knee replacement surgery, leveraging unused weekend operating room capacity. To address the surgical backlog that resulted from the COVID-19 pandemic, the Ministry of Health funded the Multi-Hospital Track Initiative to develop a sustainable, integrated regional program that allowed for timely access for patients requiring hip and knee replacement surgery, utilizing a singular hospital site and performing scheduled surgeries on weekends. Thank you.
Thank you so much. We're really grateful to be nominated for this award. I am Amy Wainwright, Manager of Rehabilitation and Program Development at Sunnybrook Collins Centre, and I have with me Barb MacArthur, who's Manager of Operating Services, Dr. Paul Wong, Orthopedic Surgeon Michael Guerin, and Dr. Colin McCartney, Chief of Anesthesia for Sunnybrook. This award is a wonderful recognition of a tremendous amount of work from a large number of team members from all 4 partner hospitals. We are very proud of what the Toronto Regional Arthroplasty Collaborative has been able to achieve, which includes creating a sustainable collaborative model that helps to meet the needs of Ontarians. TREC is a partnership between 4 partner hospitals, which includes Sunnybrook Health Sciences Centre, Michael Guerin Hospital, Sinai Health, and Unity Health. We will be sure to take this award back to the larger team to celebrate this as one of our successes in the program. Thank you very much.
So next I'd like to ask Staney to come up and give closing remarks.
So the only thing standing between you and a few more drinks and maybe a bit of dessert is me, so I'll make this really brief. Thanks to everyone who's here. Thanks to everyone who presented. Thanks again to Betty Miracle for coming here and opening us today in the right spirit. And I just want to say thank you to everyone. This is the sort of stuff that restores and builds trust and confidence and hope in our system. And I hope it's something that we can continue to do and make this just the first annual, not the only annual. Anyways, with that, thank you and have a good night.